Hi, my name's Toby Hammond. I'm a consultant surgeon and I have a specialist practice in groin and abdominal hernias, as well as certain bowel-related conditions. When I mentioned that one option regarding the management of a hernia is to do nothing, that generally only tends to apply in male patients who have minimal or no symptoms. So in other words, you might notice that you've got a bulge, but it's not causing any pain, it's not impacting on your quality of life, it's not impacting on your ability to work. In that setting, if the patient doesn't feel that they want to have an operation, then it's perfectly safe for them not to. One of the things patients worry about is the fact that they're going to get something called an incarceration or a bowel obstruction or a strangulation. And what that essentially means is that the bowel that's caught within the hernia can get blocked, or even the blood supply to it can get impaired, which can then mean a need for an emergency operation. And people do worry about that. But actually the chances of that occurring are really, really low, particularly if you've got a minimally symptomatic hernia or one that doesn't cause you any symptoms at all. So it's safe to leave a hernia in that setting because the chances of you needing something doing as an emergency are pretty low. But generally speaking, around half of patients who choose not to do anything will change their minds within about 5 years, and if not more than half. Hernias aren't generally life-threatening at all. What they are is quality of life-threatening. And so hernia surgery is a quality of life operation, so patients can live their lives in the way they want to live them. They can work, socialise, and do whatever they want to do without having to think about this odd lump that they've got. So it's important work to fix hernias, but generally speaking, unless it's an emergency situation, it's not life-threatening. It's not a life-threatening condition. So patients that have certain types of cancers, yeah, they have to have surgery because they don't want to die of their cancer. But if you have a hernia, you're having quality of life surgery. And there is an important distinction to make there, because you've got to weigh up the risks and benefits of not operating versus the risks and benefits of having an operation. And if you're doing it for quality of life reasons, then how you think about that risk benefit is dramatically different to if you have, say, a bowel cancer where you have to have it removed because you don't want it to progress and it to end your life, and therefore the risk benefit ratio will kind of change. If you think you've got a hernia, please go and see your local GP. They will assess you, and if appropriate, they will refer you on to see a surgeon such as myself. If you want more information about hernias in general, I strongly recommend you go to the British Hernia Society website. They've got loads of information there for patients about different types of hernias and different treatment options. There's also the European Hernia Society website, which actually has a section called Guidelines, and it talks about all different types of hernias with all the international and national guidelines for how to treat different types of hernias.